Good afternoon. And today we have a greatest honor to interview Dr. Mike Mew. Good afternoon, doctor.
Good afternoon. Hello. Welcome. Pleasure, Maria, to be on your podcast. It is.
Absolutely. Mike joined us from London. And it's actually, I want to start with a little story about this interview because it took me exactly a year to convince Dr. Mike Mew to be on this podcast. My respect to this individual is absolutely enormous. And we're going to unfold it more. But again, thank you very much to my audience. If you have trouble sleeping or sleep next to the snoring partner, this program is definitely going to be for you. Because Dr. Mike Mew, with his work, with his lifetime work and his father's lifetime work, can help you to connect the dots to your sleep and breathing disorder or your partner's sleep and breathing disorder. Or if you're a medical professional who, just like us, trying to put all the puzzles of this strange and modern time epidemic of sleep and breathing problems together, this program is definitely going to be for you because we're going to talk about roots of this problem in evolution, in orthodontic, or in the way our society function. And first of all, I want, for people who, Mike Mew is world-known orthodontist and his father, John Mew, they invent Mewing, related to the name, and they're very popular online and in scientific work as well. But the story, I usually like to introduce my interviewer, what I can relate 100%. I really like the part of biography of Mike, what he spent some time in Australia with Australian Aboriginal. But, I always talk about my Ethiopian experience to see what we did before, all this progress and all this invention came and become part of our life. So he had a chance to observe that in Australia, and he did similar things in Africa. And then he had his own Eureka moment when he tried mewing physical exercise for tongue, lips, posture, if we can put it this way, on himself. And he realized how position of the tongue can change the facial structure or maybe tone of the, head musculature, we put it this way. And he started working of incorporating those principles, what he learned from life, into his practice. And yes, there are a lot of details, and you can read. There are so much information about Dr. Mike Mew online, and we're going to talk about what happened with him recently with London Orthodontic Society and court and other elements. He allowed me to ask those questions. But my first question to you, I want you to, in a broad term, to introduce us. What exactly your philosophy, your and your father philosophy is? What's mewing? How can it help us to become healthier individuals?
Okay, so this is a big topic. Faces that grow well work well. So let's do as a backup. I mean, it's difficult to know where to start such a broad topic, but a few thousand years ago, everyone had space. In fact, they had excess space for 32 teeth. We know this. We've got the skulls. I mean, they're in the museums. I mean, it is a slightly different timeline depending what country and which society you were in. But the timeline's a pattern. As we've become a softer, more sophisticated lifestyle, we've gained changes. And now, most people are lucky, or they struggle to get 28 teeth in place. It's as if, the extraction of the wisdom tooth has become a rite of passage. Most people just, it's a normal thing to go through, as is orthodontic treatment, a normal thing to go through. And a lot of people, in the duration of their orthodontic treatment, have another set of teeth taken out, so premolar extracted. That means these people have got 8 teeth less than their ancestors, and they're tight of space. So you could say against a lot of their people, they are 12 teeth down. Now, what's happened? Because this has happened to all races, all cultures, all areas, all at the same time. So the suggestion, I mean, there may be some genetics in it. I'm not going to say it's purely the environment, but the suspicion does lie squarely on environmental change. Now, a lot of the research, interestingly, was done, we're catching up within the profession, but it has been done historically by anthropologists. And there was a lot of anthropologists, my favorite, I've got his book somewhere. Yeah, here we go. I've got his book here. It's not the most catchy title, How Anthropology Informs the Orthodontic Diagnosis of Malocclusion's Causes. Whoa, it didn't catch on much. But, this book, it's one of my Bibles. It really does have a lot of good information in there. And a good example is that the anthropologists were noticing that the more complex the graves that they were excavating, the more sophisticated the lifestyle of the individuals that these graves, who were buried in these graves, the more malocclusion, the more crooked teeth. Now, I'm an orthodontist, so I came at this from crooked teeth. And this is, the anthropologists noticed this, and they went to orthodontists who were less than interested. But we'll come to that. We'll come to why they were less than interested. But I'm looking at it, and I'm looking at it from an orthodontic perspective. But realistically, this is a sign. It's a symptom that the craniofacial complex, your head, and with that, your face. And I know this is a controversial issue, but it hasn't grown. Something's gone wrong, shall I say. If you're lacking all this space for the teeth, then clearly there's something gone on. And so what I'm saying, that if I were to take this cross section here, so I was to cut myself with a samurai sword and I cut myself at this section, this is where the teeth are housed. And we know there's been a dramatic change in the space available for the teeth. And so I expand this because I'm calling this the vital space. So the vital space, as I define it, is the space for the teeth, the space for your tongue, and the space for your airway. So if I were to do a cross section, I did a samurai sword cut here, and then I looked down, I would see this kind of oval space. The space for the tongue would be at the back. The space for the airway would be at the back. The space for the tongue would kind of be in the middle, curving around, and the space of the teeth would make a horseshoe at the front. And this whole space seems to have got narrower and shallower. So the cross-sectional area has reduced. And we all like to have straight teeth and we like to have a wide smile. Yeah, that's lovely. But actually, I think the airway is a much more important element within this. And I think that in what we've uncovered here, a range of problems that seem to be associated with faces that aren't growing properly. And again, I know that's a motive.
And I want to interrupt you for one second, because if my audience doesn't know, I want to bring the attention. I'm a doctor who treats sleep, dental sleep medicine. I help people reduce the blood pressure, reduce atrial fibrillation. So I know from my practical experience of 2 decades how airway is important for overall health. So I see the other end of that problem. Yeah. Not treating little kids who want straight teeth and parents want to see the, wonderful smiles, but I see very sick people 10, 20, 30 years after orthodontic treatment is complete and tongue doesn't have to wait to go besides going into the airway, and they're tired and they bring me the bouquet of medical problem in additional to sleep apnea. That's why bringing Dr. Mew on this program with his idea, starting from anthropology, is really fascinating me, because I put it in my book just like that, just like you explained.
Yeah, and I mean, so it's good often when you're doing an overview to cut things down to the most simple perspective. And the simple perspective here is that something that hasn't developed, hasn't formed, hasn't grown properly is going to have problems. And that's a simple overlay. The face is, I think we've got an elongation of the face. So we've got a reduction of the cross-sectional area I explained. And we've got a range of symptoms from this. I mean, I would suggest a lot of ENT, otolaryngology, ear, nose, and throat, as we say outside of the US, problems are associated. Just the structure is not the correct shape. We've got, I mean, the big one, clearly sleep apnea. I mean, because it's so pervasive throughout the whole body. You know, what's the most important thing in your life? Well, I would warrant it's your next breath, because I could say what you would prefer, a Ferrari or your next breath. I know
that's very clear answer, and it's so clear to me, and I'm so thankful that it's so clear to you as well. Next breath is the most important thing.
Yeah, but I think that it's where you're in dental sleep medicine, and I think that this is the number one problem, or the one symptom of faces not growing correctly. So we refer to this as craniofacial dystrophy. So dystrophy just simply means incorrect growth. Okay, trophy means growth. Dys is incorrect. So we're saying it's incorrect growth of the craniofacial complex. That's craniofacial dystrophy. It says what it is on the tin. Now sleep issues are clearly the biggest problem. They're very pervasive throughout the body. I mean, you don't sleep well, it destroys your body. You don't breathe well, it destroys your body. But of course, we've got jaw joint problems, we've got crooked teeth, ENT problems. Now, if you can't breathe properly, you don't have enough space, you tend to push your head forward. That then has ascending problems. It's a forward head posture. That tends to lead to anterior pelvic tilt. It tends to lead to foot problems, all kind of issues. Now, there may be ascending problems compounding this, but there's just a huge volume. I think that there is good evidence to suggest a lot of scoliotic patterns are induced by a forward head posture and asymmetric head postures. So it goes on and on and on. And clearly the biggest association at the moment that's within the professional sphere, within our Maria and my sphere. So when we're going to lectures, the two big things we're talking about is sleep and orthodontics. These two areas have come together, and this is the commonality. We're looking at the same structure. I'm talking about that vital space. That vital space connects us both.
Yes, absolutely. And it should connect all the orthodontics and the rest of the medicine. And I'm sorry to interrupt you, but I think my audience will be very interested. Number one, I want to mention, you can find out a lot about Mike Mew from his website, and please explore Mewing application. But very important, Dr. Mew organizing a wonderful Mew conference in September in London, and you can, do it in real life, or you can do it virtually. Please, find out more about the conference and attend. I attend myself, and I learn so much, and I met a lot of fascinating people who I invite to my channel, and they, nourish my audience with the knowledge. So it was really great, and with a lot of them, we become a really close friend because we have the same philosophy. Yeah. So that was wonderful. And I'm gonna devote several of my broadcasts to that conference as well before the conference starts. So I invite other speakers of that conference on my program. But I want to ask you, Dr. Mew, why? Your philosophy is so clear to me. I see it in my practice. every single day. When patient with sleep apnea come to me, I see that. The patient without sleep apnea, what TMJ come to me, I see the same principles, what you describe in your philosophy. Why orthodontic society really got against you and did this, in my opinion, very ugly case and punish you so much? Why is that? Where do you see the roots of that? For me, totally, it doesn't make sense at all, but totally that rage, no reason rage against you. Why?
Well, I mean, a part of this is it's Britain. You know, Britain is a country where, you know, when we were invaded by William the Conqueror, he said, "I want England people respect the law and pay their taxes." We tend to be a conformist country, and particularly with the National Health Service, people like to conform, and it's when orthodontics started, it was about straightening teeth, and they got very good at straightening teeth. And we then had this evolution of evidence-based medicine. Now, at the time, I remember Professor Sackett's in the 90s comparing orthodontics to Scientology and reflexology, I believe it was, and homeopathy in the level of science we had. And, you know, with due respect, orthodontics tried then to validate what they were doing, but there's always a problem. When you try to validate what you are doing, there's an inherent bias because you're trying to backfill your science to support what you are already doing. And if you are making the teeth straight, and of course, that's what orthodontists do, it's a mechanical method of artificially arranging the teeth so that they're in alignment. And it's very effective. And I mean, these are highly qualified people. Most of them are very ethical, and they study for a long period of time, and they do a lot of research within the paradigms that they have set out. You know, and however, they're confined within these paradigms because as the science started to build up, it became apparent that this wasn't actually a genetic problem, or predominantly it wasn't a genetic problem. And in a way, they needed it to be a genetic problem. They'd almost pushed themselves into a hole by saying that if we're going to artificially correct something, it's so, you know, it's like you have a phenotypical expression. So a phenotypical expression would be you have blonde hair or you have dark hair. That's your phenotypical expression. And if you don't like that, then you're going to have to get someone to help you change it. So you have your hair dyed, blonde or dark, whichever your preference is. And if your teeth are crooked or you've got too many teeth, well, that just must have been something wrong. And it's very convenient. It fits with the treatment were it to be genetic. And whenever you have a bias, you always run that slippery slope of slipping into the bias. That's why so much, you know, all the research that Corricini's done here is ignored. I mean, one or two of his papers I've seen quoted. I've even seen Prophet misspelling Corricini's name in references. I'm sure that was a genuine mistake. But what you've got is a disconnect. So the orthodontists have gone further and further within the parameter, and they've done some brilliant research, you know, brilliant research on bone biology, on how to move teeth, on what to do, but they've not gone past that invisible line to ask the questions of why. What's the cause in the first place? And they've also put their parameters very much within we're only going to consider the teeth. And again, you alluded to my court case. So in my court case, I wanted to give an explanation to my patients of what I was doing. So I'm on the spectrum. Never would have done this if I wasn't. So I set off and I wrote this eloquent essay on my beliefs and what I was doing. And as my lawyer said, if you'd put a load of maybes, probablys, question, they would have had no case to get me. It was this document that I wrote that damned me. And if you were to read that document, or if anyone in our area with our mindset, they would go, wow, that's a really good essay. You have nailed it on that essay. I spent a lot of time putting it together. And I did do a lot of, I thought I wasn't overstating it. I thought I was quite, really genuine in writing that, because I wanted to explain to my patients what I was doing. But had I not given them that document, there would have been no case against me. I mean, one of the outcomes was brilliant. It was, and parents were overjoyed. So was the child. And the other case, it just didn't get going. And I didn't do the treatment. So, this is the one you mentioned. You look at the press with my name and you'll see seizures. Really? No, you had a child that didn't want to wear the brace and had a tantrum when his mother tried to put it in, which they described similar to a seizure. So it's just, the fact that was all over the press when it was such, I didn't do the treatment, I just treatment planned it. Someone in my clinic did do the treatment. And the fact that was in the press is just why? How did that get there? And very much, how did that information arrive at the press's door? And how, if so, what's the General Dental Council, my regulatory body, doing that ends up in the press? And, where's there? I mean, it's a shame, because I did a campaign. I did a massive campaign. I started in 2009 and I wrote an editorial in the British Dental Journal. I then went on to have, I wrote to I went to Parliament. I had a question in the House of Lords. I wrote to the 4 chairs of the General Dental Council, the British Orthodontic Society numerous times. Every house, the Minister of Health and the Department of Health, everyone. I just wrote to them and saying, look, our profession doesn't know the cause of the problem. Don't you think we should have some type of scientific engagement? We're spending a vast amount of money, because remember, within Britain, not everyone is eligible for treatment paid for by the state. But we do have the national health system. It's a socialist system. So most of the orthodontics done in the UK is paid for by the state. So they bear some responsibility. And I'm not here to to point blame and say people are doing things wrong. That's what my father did, and that's one of the reasons he was so hated. But if as an orthodontic community, you haven't focused enough on the causes of the problem, because maybe in a biased way you didn't want to focus on the causes of the problem, then you don't understand. You've got to, I'll start with the etiology. What causes the problem? What are the factors that cause something? And then you need to flesh out a pathological process by how that happens. That's the scientific method. That's what I'm calling for. I'm just calling for the scientific method. I'm not saying, my father always said he had the answers to the problem. And I think he went a bridge too far in saying he had the answers. I'm just saying, look, we need to investigate this, because there's potentially a big issue here. But if you don't understand the causes of the problem, then you risk upsetting the problem if you intervene during the growth phase. So within Britain, it's almost become standard practice to wait till the latter growth phase. Because if you're going to straighten the teeth, you also want the teeth to be there. And the teeth aren't really going to erupt till basically post 12 years old. And at 12 years old, you've got what? 5, maybe 10% of facial growth left. I mean, the lateral dimension of facial growth has probably been exhausted by 8 or 9 years old. So, if you're going to try and do expansion, which is a hot topic, it's a really, a valuable treatment in my view that you can do to younger children or even older children. Okay.
I agree. I agree.
Yeah, because I think that really helps to open the nasal capacity. But what it does, I think, in principle, it helps bunny hop people in the right direction. Because remember, we're talking about form and function. And if you can get function correct, it can help with form. Again, I would move function across to posture. Okay, but we can come back to that. But either ways, form and function are integrally related. And if you can open someone's nasal airway and then encourage them to use it and get them to change habits, that can be a really, really powerful thing to do. But coming back to that thing of my profession, they're tending to treat later. And they're tending to only focus on the teeth because they've created this paradigm within which they work. So when I started to explain to my patients that one of our aims and objectives was to improve the nasal airway, to gain a large amount of expansion, and I went, I this broad conversation I had. Well, that formed all of the charges against me. You said to patient A that you were going to create a large increase in the nasal airway. Yes, that was my objective. Okay, sorry, that I've written that on a piece of paper and you disagree with me. And then I got the most, what do we say, dyed-in-the-wool geneticist. I mean, these guys were absolutely certain that, although clearly at every junction they said, we don't know the cause. But they gave the impression that it's always genetic. I mean, it's crazy. I started this, I had this great big campaign to try and elucidate or encourage my profession to some form of engagement on the cause. I thought that was a very sensible thing to do. I think I clearly exhausted all of the professional avenues in which I could raise awareness. And then I went into court. So I wanted a debate in a scientific forum. I then went into this court case where I ended up being judged in a legal forum. And it was most bizarre. I mean, the key domino in this was the cause of the problem. And all the other judgments are based upon that. If you were to turn that domino and say, well, actually, no, I mean, the evidence clearly suggests it's predominantly the environment, not the genes, then my whole case would fall apart. The whole judgment against me, well, most of the judgment against me. I mean, they're going to get little bits and pieces. I mean, well, I didn't, I'm not taking the x-rays, the type of KEF x-rays. I just, I question their validity. We're taking 3D, well, we were, because I had to close my clinic. I went bankrupt. And, now it's a struggle to pay the rent at the end of the month. So, and it's annoying. It's doubly annoying when you really believe you did the right thing.
And I believe you did the right thing.
Yeah. And, I had two patients. One, as I said, one patient, I mean, they did nothing right. They didn't get going with treatment. They did everything wrong possible. It was a litany of mistakes. And then when the mother didn't like me because, and this is a classic problem. She liked my employee, my associate dentist who was doing the treatment, but the associate dentist should have pulled her up and stopped the treatment. But the associate dentists were making lots of compromises, which literally, had I been aware of all the compromises they were making, I would have just said stop. In fact, at one point I had to come in and say stop. But then, of course, what does the mother think of me?
I want to interrupt you because it's a very dramatic story, and it's even hurt me to think about what you got through trying to prove your idea right. But as a doctor who treats adults, I know inside of me what you are right. And I think function define the form. And I see that all the time. And I see people in my chair who cannot even find the tongue. They don't have those connections. They, like that ability of feeling the body here kind of lost. And people constantly clench to find that perception. So a lot of things, what you're saying, resonate with me 100%. I'm a big believer because I see the practical proof of your words, but in the same time, I know what legal system is not always reflecting what really historically become the truth. So I believe you put the seeds of something what's gonna grow into the very beautiful change of our profession. And I really hope it's gonna happen as soon as possible. And I think people who listening to this program can attend your conference and learn more and become believer just like I do.
Yeah, I mean, I don't want people to go. In science shouldn't be a place of belief. Science should be a place of scientific fact.
True.
And evidence-based. It's not supposed to be a place of opinion. And I worry that within my profession, there's been a vacuum of hard facts, and it feels like, it feels religious in many respects. People constantly say, oh, so and so said that, and I go, I don't give a damn who said that. Where's the evidence to support it? And we need to be evidence-based, and we need to be engaged in open, free. My desire is to have a free, fair, and full engagement on the cause, and then work up. And I don't think, there is this, the elephant in the room when we're talking about the disagreement between me and the orthodontists is whether at times some orthodontic methods can lead to a downswing in facial form. So
Yes, it does, because I see those people with forward cuspid extension. I never met one person who did not have 1, 2, 3, or 4 problems health-wise. That's me, who, I always want to be an orthodontist, but I'm not an orthodontist. I'm a dental sleep medicine doctor who helps people to sleep and breathe at night. So that's me. That's me who see the opposite side of the problem.
This is where I'll send you a link. I'll send you a link of when my father in 1998, he went on a television program, and we've got to remember the context back in 98. In the UK, we had 4 terrestrial television channels, and it was on Channel 4, a program called Dispatches. He'd treated a patient, and the mother of the patient she ran this program, Dispatches. And she'd been told that she would need teeth taken out on her child. My father treated the child. He got a really good result without taking the teeth out. And she got to know my father. She then organized this television program. And they had 4 dentists were interviewed who did not mainstream treatment, tried to do some manipulation, tried to intervene in the way children were growing to try and get a positive improvement. Okay, so they were, we could say there were people who believed it's not all genetic. Okay, and then they had conventional orthodontists, and like, it's a British program. It was a quality program. They got a good impression on both sides. But at one point they asked my father. They said to my father, can orthodontics damage faces? And he makes a comment back. Yeah, he gives some statistics. I'll send you the link. You can put it under the video.
Absolutely.
And that destroyed his reputation. That was remember at the time there was no social media. He couldn't go to social media. The profession controlled the narrative, and they deemed he was completely wrong. And I remember that they forced the program to have a right of response. So before the next episode, or the episode 2 after, I think, they had a 5-minute response. And I remember they interviewed several orthodontists who gave their opinion, and it finished with this one individual, and he was kind of spitting into the camera, and he goes, orthodontics never damages faces. Clearly, if you're going to force someone to give a right of response, they're going to choose that little bit where you look the worst. And this guy really did look the worst at it. But in saying that orthodontics never damages faces, he kind of set the profession up in a way. But, what I'm reading now, when I move forward, and I'm not I don't want to go out saying orthodontics always damages faces. I'm not saying that, but I do think occasionally some treatment methods may cause a bit of a downswing in facial form. So if our ancestors were up here, modern humans a bit further down, and people with big problems are further down. And that's an overall simplification, because as your face downswings, you're going to respond. You've still got to eat, you've still got to breathe, you've still got to walk and do and speak and do all of your normal functions. So you will individually choose a place. Well, you've got to put your tongue somewhere. You've got to rest it in one position. And some people will rest their tongue evenly, you know, like a bit like this. And they get what's referred to as a class 1.
Yeah.
Some people hang their tongue forward, and they get what we refer to as a class 2. And some people, well, they drop their tongue into the bottom jaw and hold the jaw forward. All great methods of maintaining an open airway.
Yeah.
But depending on which response you choose as an individual, that will determine what pattern of malocclusion, as we call it, crooked teeth, that you express, you end up with. So, and there may be genetic links to how that occurs. I mean, you know, we see this pattern where class 3, the sticky forward, is much more common in the East, within, you know, China, Japan, you know, all of the Eastern countries over there. That's more common. And where the class 2, you know, the whack jaws. Remember, the American Indians used to refer to the arriving Europeans as whack jaws. Because, and all these Indians had fantastically developed faces, not as good as those skeletons we're digging up. Because remember, you get a knife and you've massively started to change your habits. You know, before knives, you incised with incisors. Everything was like that. Before you had a knife, every single thing you incised was done by a lateral force on your front teeth. And as soon as you have a knife, you've already dramatically changed your lifestyle. And so when we're looking back even at contemporary Aboriginal people, you know, people living very natural lifestyles now, who have much better facial form and generally straight teeth. You know, that guy walking off the African Serengeti, standing beautiful, just amazing facial architecture, a big broad smile. And it's not just him, it's his brother, it's his uncle, it's his aunt, his grandparents, all the kids, the whole tribe. And we know your ancestors, whoever's watching this, it's irrelevant who's watching this. We know your ancestors look the same. Got the skulls, mate. There's no getting out of that. That's how all humans were. You know, you don't see much malocclusion or, you know, incorrect facial development. You know, kids are like this, or animals like that within the rest of the mammalian population. Yeah. Except clearly a little bit of domesticated cats and dogs, and in Britain where the feral foxes have come into modern towns and cities, we're seeing a bit in there. But that's kind of what you would expect, because they have changed their lifestyle as well. So, you know, we're looking at a lifestyle change, and if we understand the process, and I'm not saying orthodontics is wrong. I'm saying that, yeah, I think most orthodontists, in fact, every orthodontist I've agreed with, knows that it is possible to get inappropriate facial growth. Okay, it happens. And you know that because you're treating the downstream consequences of it that often aren't apparent when you're 11, 12, to 16, you know. But Maria, you're going to see people further down the line, and they have problems, and for you it's going to be relatively obvious. You know, you don't need to be the most wonderful person at pattern recognition to see that there's certain patterns that are causing problems.
Absolutely. No, I see it all the time. Thank you very much. You gave us so much knowledge, and I want people to attend your Mew conference, and we're going to put all the links underneath. So thank you very much. We're looking forward to see you again on our channel, and I really appreciate your time.
Yeah, because this is what you can do about it. Mewing is the solution Yeah. And it comes
I
from my
agree.
father's concept of the tropic premise: lips together, teeth together, tongue on the roof of the mouth. That's how you
Absolutely.
should be. And people like that grow well. I mean, how did our ancestors have straight teeth? What did they do?
Thank you very much. And Mewing, I'm a big supporter of myofunctional therapy, where we put principles of Mewing
It's a
into
principle.
the training program. And people with sleep apnea, they do get better once they learn those principles. Maybe not 100%, but even if they get better at certain percentage, it's already make a life happier and healthier.
I mean, we know so many people go and run, they go and exercise. Okay, we know that's valuable for you. Well, we know that stand up straight and shut your mouth. We know that's valuable for you.
Yes.
Why aren't we focused on it as much? That's what mewing is. You could break everything I'm saying down to stand up straight and shut your mouth. Breathe out your nose. Chew gum. Build the muscles up. You know, I've got a strong face.
Yes. Thank you.